Have you ever heard of a disease that causes heart rates to spike, such as POTS? Have you ever been laying down and stood up too fast, causing a lack of vision and dizziness? People who suffer from POTS live with this every day. Standing up may be a normal thing to you, but to people with POTS, they have a heart rate increase of at least 30 beats per minute. POTS is a difficult disease to live with that's affecting many Americans. I was diagnosed with POTS earlier this year in July. I have listened to my doctors and done my personal research to gain my understanding of POTS as well as symptoms I have experienced. First, I will start with the general symptoms of POTS. Second, I will get into the effects it can have on your personal life. Third, I will discuss the process of getting a diagnosis. The most talked about symptoms of POTS are the increased heart rate and dizziness. However, there are many more symptoms besides those two. There are also symptoms of weakness, fatigue, headache, digestion-related problems, trouble eating, and exercising. This all is according to NIH News and Health. Many people with POTS have similar digestive-related problems related to IBS. This leads to many people with a misdiagnosis of IBS before a POTS diagnosis. POTS is short for postural orthostatic tachycardia syndrome, and the symptoms come from your body position. Going from a standing position from a seated position results in people with POTS to have a heart rate increase of 30 to 40 beats per minute, depending on age and your lifestyle. Orthostatic means related to posture, and tachycardia means rapid heart rate. Normally when a person stands up, blood pulls to your leg and feet due to gravity. For a second, this reduces to the upper body. This causes the brain to tighten the blood vessels and make your heart pump faster. People who suffer from POTS, their blood vessels do not tighten enough after standing. This results in a faster heart rate than normal, according to NIH News and Health. These symptoms can affect physical and mental health. Many people with POTS also report cognitive dysfunction. Cognitive dysfunction is related to as things such as brain fog, mental fog, and mental fatigue. These are all terms meaning intellectual function are impaired. Furthermore, patients often experience mild to moderate anxiety and depression symptoms related to living with a chronic illness. According to social media questionnaire by NIH National Library of Medicine, 95% of people with POTS have self-reported cognitive dysfunction. NIH National Library also claims patients are often diagnosed with depression and anxiety prior to a POTS diagnosis. Aside from symptoms of mental-related challenges people with POTS suffer with, let's get into the diagnosis process. Depending on what state you live in or access to healthcare, diagnosis may vary. People who suffer from POTS often are diagnosed with other things prior to POTS, as mentioned previously. Often patients experience stomach and bowel issues, leading to scheduling an appointment with a gastrologist. People with POTS experience nausea, vomiting, bloating, diarrhea, and stomach pain. Many of these symptoms lead to an IBS and false diagnosis of IBS according to the POTS from UK. POTS are ruled out when there is no acute blood loss or dehydration upon standing. Orthostatic hypotension is a form of low blood pressure. Most cases, symptoms must be present for months to get a diagnosis. A tilt table test is commonly used for a diagnosis of POTS. You are secured to a table while laying flat and then raised to an almost upright position to watch for your heart rate increase. Your body must produce an abnormal heart rate for a diagnosis according to Hopkins Medicine. To conclude, POTS has a wide variety of symptoms and effects. POTS affects 1 million Americans, giving them daily struggles and difficulties. Remember, there are many more symptoms to POTS besides fast heart rate and dizziness. Look out for common misdiagnosis of POTS for yourself, family, and friends. Understanding symptoms of POTS can help you gain more understanding of people who suffer from not only POTS but other chronic illnesses. I hope I can leave you with a better understanding of POTS besides just a fast heart rate and dizziness.